Today's part 2 of 3 on gag reflex and dentistry. So we'll roll that intro. Let's get into it. What's up, everyone? Dr. Eric Jackson here. Hope you're doing well. Today we're going to do part 2 of our 3-part series on gag reflex and dentistry. Part 1, and I'll link to it above. We combine knowledge on a little bit of background on what gag reflex is. Why do we even have a gag reflex? Who doesn't have it? Do people really do that? The answer is yes. So I'll encourage you to watch that video prior to this one so you'll get a context for this video. We also touched on the physiological aspects of solving or at least reducing some gag reflex in the dental office. The main one being a 20% benzocaine spray that you can spray in the back of the throat to really just numb that gag area and then get in and get out quickly as possible for the patient. So part 2, we're going to talk about, in addition to the physiological aspects of it, well, what if the patient doesn't really respond as well as you'd hoped to the benzocaine spray? Well, there's other things that hopefully are already in play in the psychological genre, right? Psychology and dentistry are something that really I've always focused on. I think it's very interesting that they're so connected, right? It goes without saying that society looks with a negative eye on dentistry. Dentistry is going to hurt. Parents often say that to kids to make at a very young age to make them brush their teeth. Something I don't recommend, by the way, but there's a disclaimer here. But always try to promote positivity in the dentist, because then eventually, if the child needs cavities, now it's been ingrained in them that it's going to be terrible, it's going to hurt, and it just makes actually treating children well very, very difficult. And so, total side note, but promote positivity and the benefits of brushing, not the negativity of not brushing when you're dealing with young children. So psychology, it permeates all our lives. I try to make sure we borrow from psychology from the moment the patients enter the building, because there's a lot of dental anxiety, and dental anxiety, like you said, stems often from childhood experiences, whether it's from perhaps misguided but well-intentioned advice from parents. Perhaps there's some lousy past dental experiences actually, rendered in the dental office. Very common, unfortunately, and ultimately it's one of those things where when a patient walks into our office for the first time, I really want to make sure we can unpack a lot of that and leave that stuff in the past. It's sometimes easier said than done, but there are many ways we can do that. From the moment they walk in, they're greeted by a non-traditional dental smell, right? Smells are very important. That traditional dentist smell of eugenol and cloves and whatnot. You're in a dental office, which often invokes past feelings of anxiety and fear, and it starts the ball off on the wrong foot, and that person's taken literally one step into your office. So we use everything. We've used everything in the past, from air fresheners to and now we're currently using essential oils, and we're just being able to tailor make those towards the season, which is really quite nice. Around the holiday time, it's a lot more evergreen, pine, cranberries, that kind of stuff. In the summer, it's more, in the spring especially, it's more flowers and fun. And it's actually a lot of fun. The staff, we put our heads together about what we like, what we don't like, and what isn't overpowering, which is just kind of tolerable for all patients. And it really does set the tone, much the same way that paint color sets the tone for a room. You're going to have a cool color, a calm color, a neutral palette versus bright orange, bright red rooms. It invokes a lot of intensity, and you're not going to want that. So this whole conversation is a very much different video, but I'll bring into that. It's very important that you provide a calm setting for that patient, because they're coming in and hopefully unpacking a lot of that negativity before they sit down in your dental chair. Once they get to the dental chair, well, what might they do? Want to make sure that they have time to take a break for the bathroom. Being anxious often involves needing to go to the bathroom, and so if they're trying to avoid having to get up, and if they have to go to the bathroom, that's never going to make anybody calm. So giving them time to, making sure that the staff knows where the bathroom's at prior to the visit, letting them completely relax and go into it with a clean head is a good thing. Once they enter the room, music, allowing for, we allow for AirPods and earbuds, and we've got our own, smart speakers there, so you can turn on your, and it's a really important thing because choosing music, it deals with a lot of the psychology of dentistry. With it's loss of control. It's you're not in control of something anymore, and that's a very important part for many people. Losing control or not being in control, it permeates a lot of our lives. And when you're allowing another human to also go into your personal space, there's somebody literally inside your mouth, inside your body, certainly within your personal space, doing things that are although they're technically out of your control, you're not in control of what their hands are doing. All these things start layering together. Picking your own music seems silly, but it makes a big difference. And let's get back to gag reflex. By reducing anxiety, you often reduce gag reflex. Patients that are very worked up, their fight or flight reflex is going, you're able to then bring that down a huge notch. And you'll see, maybe not the very first visit, but the second visit, the third visit, the 10th visit, however many visits it takes. Compare John Doe or Jane Doe on visit 1 to John Doe and Jane Doe 5 years later. Massive improvement as far as reduction in gag reflex, overall enjoyment of office visits. Quite often we'll have patients saying, I can't believe I can actually do this now. I really appreciate all the things that you guys do, because whether they know it or not, there are a lot of things playing around in the background. I think that's wonderful. It's a wonderful compliment, and we always appreciate getting those. One of the most common aspects that you may or may not be able to use in your practice, but and also you may or may not be able to receive as a dental patient, is laughing gas. Laughing gas, I like it a lot. The vast majority of patients can actually benefit and receive laughing gas. It's wonderful because it gets in, it gets out, it doesn't linger. You can drive yourself to and from, and it works out very, very nicely. There are obviously other options out there, from oral sedation to IV sedation. All of those are very applicable. We're not going to get into that here. But with that said, they're far more invasive. They're far more, they affect the life. They affect you got to be driven, you got to be to and from, you got to get a poke in the arm. Let's just focus on the fact, easy things that people can do to decrease anxiety and therefore decrease gag reflex here today. Another few tips for you. If you're a little anxious, having the patients communicate, very important. It's always trickier, both to numb the patients when their heart's pumping, both to function well, both, when someone's really nervous. Everything from my jokes aren't even as funny, which they're not normally very funny anyways. But if you're not relaxed and actually able to get through, you're not going to laugh. You should be able to have a good communication with your dental team, a good communication back and forth between the provider, the patient, and that goes a long, long way. Being able to do that, it truly does matter, and well beyond gag reflex, but just general patient care. Saying that you're a little bit anxious, saying that you have a gag reflex. Patients often don't understand that those two things are very closely related. So giving them some dark sunglasses mutes the room. Perhaps even dimming, if you've got the dimmable ability to dim your lights in your operatory. Well, perhaps you wear loops and a nice headlamp. Well, the nice part is dark sunglasses, chill environment, some soothing music, emulate some spa type stuff really does matter, because that's what spas have been doing for, years and years and years with wonderful results. The whole point is relaxation. And what works for one person doesn't work for necessarily everybody else. So the ability to use a smart speaker to put on something that they like. It could be, we've played everything from, ocean waves to children's music when the kids want to come in and they want to listen to their favorite band. Then all the way up to, when the adults, you want to relax. Some people relax with Metallica. That's fine. I have no problems listening to Metallica if it makes the patients very calm and happy. And you know what? If the patient's having a great experience, a great time, that means that odds are the dental providers are doing a great job and it all works really well together. So those are some nice tips for part 2. I think we'll end it here. Part 3, we're going to tie it all together with a nice bow. We're going to talk about how you can possibly unlearn your gag reflex. So we've talked about thus far the physiological, we've talked about the psychological, and we'll talk about the actual practice of unlearning a gag reflex at home. So thanks for watching so much. Appreciate it. Leave all your questions below, comments. Of course, thumbs up the video, like it, subscribe to the channel, and I'll see you in part 3. Thanks so much. Talk to you then. Bye-bye now.